Hi everyone. In this clip, I will talk a little bit about irritable bowel syndrome. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. So irritable bowel syndrome, or IBS, is a common ailment that affects the large intestine. It's recognized by a range of symptoms, including abdominal pain, cramping, bloating, and changes in bowel habits like diarrhea or constipation. What makes IBS different from the occasional unsettled stomach is its consistency. You'll experience patterns of stomach pain, cramping, bloating, changes in the appearance of the stool, and abnormal bowel movements. IBS symptoms are also usually related to the stress levels. So if you're dealing with a lot of stress, IBS symptoms can get way worse. Some people can be significantly relieved from IBS quickly, but sometimes it does take weeks to months. Healing includes lifestyle modification, changing in diet and exercise, changing sleep patterns, and perhaps medications. Conventional medicine, unfortunately, does not recognize a cure for this ailment and treats IBS primarily focusing on the symptoms, and medications are given to provide relief from constipation or diarrhea and others that can help reset the gut microbiome. But this general approach will not work for everyone, of course, and it is best if this is sort of looked at case by case, as with any other ailment, I should add. So, in the cases where the person has IBS and not other bowel issues, adding soluble fiber to relieve diarrhea and constipation, as well as helping the food digestion process to become a bit slower, hence preventing the internal muscle spasms, is helpful. They normally recommend barley or lentils and nuts and oats and flaxseed. I'm a fan of psyllium husks. They're quite available and inexpensive and do a phenomenal job. But when increasing your fiber intake, go slow and drink plenty of water. Increasing the intake too quickly can bring on symptoms like gas and bloating, which is what we are trying to avoid. And ingesting too much fiber can and not enough water can make constipation worse. So start slow. For example, start with a teaspoon of psyllium in a large glass of water, and then give it a few days and make it like, let's say, a spoon and a half, and then 2 teaspoons, and so on. Make sure if you're doing this, it is not at the same time as your food, medication, or vitamins. Psyllium will not allow the proper absorption of other nutrients or medications. Another helpful nutrient is magnesium citrate or magnesium hydroxide if you're dealing with constipation. Now, magnesium draws water into the intestines to soften the stool and make it easier to pass. But magnesium may not be the answer if you have diarrhea. It may lead to diarrhea if you take too much of it as well. So around 350 milligrams a day seems to be the sweet spot most of the time. Melatonin also is a helpful hormone that is produced by pineal gland that helps with sleep regulation and digestion. For those with IBS, melatonin regulates intestinal motility, which means the movement of intestinal muscles. Now, there was also a study done back in 2023 that recommended 6 milligrams of melatonin daily, morning and evening, as an effective treatment for reducing gastrointestinal symptoms and improving the quality of life for people with IBS. Now, I personally would not continue the melatonin intake in the morning for too long and would opt out for night only. And not just because of the way melatonin acts in the body, but also the fact that melatonin can interact with other medications, including immunosuppressants, blood thinners, and some diabetic medications. So it's important to discuss with your doctor before you start if you're already on medications. Then there's probiotics, especially lactobacillus and bifidobacterium are the most important parts of healing IBS, and they keep the digestive system healthy, and this is what is needed to restore balance in an otherwise troubled intestine. But if you're buying the product, consider buying one with more strands for overall health, probably 11 or more, and one which has probably prebiotics as well. Good multivitamin alongside B complex and B12 and vitamin E, as well as vitamin D3 in 3,000 milligrams a day, plus K2 5,000 milligrams a day, not micrograms, I said milligrams a day, is also suggested when treating IBS. Many also suggest hypnotherapy and acupuncture. Of course, relaxation and meditation and regular breathing exercises are quite helpful. On the metaphysical and emotional side of this ailment, the root cause points to stressful life events, anxiety, depression, adverse childhood events like abuse or neglect. Beyond emotions, spiritual imbalance may also contribute to IBS. In spirituality, the gut is considered the center of intuition and emotional processing. When there is disharmony in our spiritual or energetic body, it can manifest as physical discomfort or illness. Unresolved spiritual conflicts, lack of connection to our inner self, or a sense of disconnect to our inner self, disconnection from a higher purpose, I should say, could impact gut health. So cultivating awareness of our thoughts, emotions, and spiritual needs through practices like mindfulness, meditation, yoga, and deep breathing can help tune into our inner selves and become more attuned to the subtle signals of our bodies. By addressing underlying emotional and spiritual imbalances, we can experience relief from IBS symptoms. Most important part of this is finding inner peace and acceptance. This doesn't mean pulling ourselves away from the conditions, but rather embracing it as a part of our journey towards greater self-awareness and growth. Through practices like meditation and prayer, a sense of calm in the midst of storm, so to speak, is created, which eliminates stress and promotes faster healing. Hope this has been helpful. Like and follow for more. Be the light.